the JAMA Network.
These patients who had previously been at high risk of dying now survive, but perhaps have long-term recovery problems.
Dr. Derek Angus from the University of Pittsburgh Medical Center and co-authors examined the relationship between critical illness and psychiatric illness. They examined medical records of all patients across the country of Denmark admitted to an ICU over a 3-year period.
We were interested in people who got a new or sudden critical illness, such as a pneumonia or an episode of sepsis.
Patients who were also on a breathing machine were compared to other similar patients in the hospital and in the general population. First, researchers wanted to know if any of these patients had some type of psychiatric illness or were taking psychiatric medications before entering the ICU.
Patients who came into the ICU were in fact more likely to already have pre-existing psychiatric illness or to already be on psychiatric medications.
The study appears in JAMA, Journal of the American Medical Association. Researchers also looked at critically ill patients who had no prior history of psychiatric disease or taking psychiatric medications.
There was an absolute new risk of new psychiatric diagnoses and new psychoactive medication use. Even though it was less than 1%, it was 20-fold higher than the likelihood of getting a new psychiatric illness had you been a general population member with similar underlying characteristics.
Researchers say this absolute new risk might be seen as low, but it was far higher than expected.
We have to counsel our patients and our families that this is a known complication of surviving critical illness.
Catherine Dolf, the JAMA Report.